Hello everyone, my name is Bradley Cohen and this is my mediated presentation for my informative speech. Now people too often visit their doctor for musculoskeletal pain because of an unknown reason for the pain or a simple fix. By searching beyond immediate relief for musculoskeletal pain, people can find long-term solutions, including working at home with a proper diagnosis. Now, how many of us have woken up with a twinge in the neck? I know I have. Perhaps too much partying the night before watching Mizzou win? It stays though. And what do? Most of us wait, hoping it will go away eventually. When it doesn't, we reach out to our internal physician, the person we see for everything. Mizzou won, by the way. When properly diagnosed by a clinical chiropractor, people can find long-term relief rather than what a pill can do for short-term relief. Now, at the end of the day, our doctors want the best for us and to help make us better. So they prescribe a medicine for acute and immediate help. But it doesn't always fix the underlying condition. It's a Band-Aid at best. If more people looked for the clinic treatment to find the root cause of their pain, they would not only find long-term benefit and help them be able to treat themselves appropriately with greater benefit and relief, but they would find that it saves them money, guaranteed. Pain is not something to be overlooked, and the longer you treat it as a one-off instead of a symptom, the longer you will wait for your relief. Clinics use new technology and continuous learning to treat symptoms based on the patient. Patients find more long-term relief and techniques to use at home once properly diagnosed. So how do we treat chronic pain without using medicine? I've got an idea. Why don't you consult with a therapist? People don't often go to the doctor for body pain. People think that once it's finally time to admit it, their regular doctor can solve all their problems. So how do we change that mindset to understand that there are specialists rather than pills to help? Chiropractors are using the newest technologies and continuously learning new techniques. In an ever-evolving technology and technique landscape, we can't ask physicians to know this too. That's why they're experts to help. Once properly diagnosed by continuous learnings, they're also taught how to help take care of themselves. Patients find more long-term relief based on proper diagnosis and being given techniques to treat themselves as well. More long-term treatment can seem daunting unless you're equipped with the knowledge that it could be the actual fix to your pain and suffering. Now, chronic or near chronic pain should be addressed at a general physician. Probably wouldn't be able to be equipped beyond short-term medicine as a remedy. So chiropractors are doctors and should be treated as people who are skilled in their specific area as well, using the most modern treatment and continuously working on their craft as such. If patients seek actual remedy and to work on their pain on their own, a clinician is the right choice. Not every back pain after Mizzou victory or night on the couch warrants a chiropractic visit or a pill, but long-term pain should be treated with a specialist with therapy by a professional. Now, with all the information I've presented to you, it's your choice. Which would you pick? Now, the 5 changes that I have made for my mediated presentation are the location where I've recorded my speech. I've changed the background. There are a lot less distractions in the background, which allows to better focus on me, the main point of attention. I've also changed the camera angle to a wider shot so you can see my various arm movements and you get just a waist-up shot, which I think is much more beneficial for focusing on me. I added a visual aid, which helps break up the monotony of the speech and also gets people deciding, make them think that they have to make a choice at the end. I use contrasting colors in this visual aid because before it was kind of hard to see what this person was actually doing. I think now that I've made a contrast, you can see clearly what they're doing. And I added in some rhetorical questions, which makes the audience feel more engaged and think that they have a bigger role in the speech, not just an audience member. Thank you.